necessary for the whole nation to undergo social distancing, but for some people it of course is much, much more difficult than others. And on the figure, I'll hand over to Steve.
8% of staff overall absent for COVID-19 related conditions. That varies by staff group and by region, as you would expect.
Great, thanks. We'll have Jerry Scott from the Yorkshire Post, please.
Thank you. A lot of focus has quite rightly been on London because that's where the majority of cases have been. But we're hearing from many doctors and nurses who see what's happened in the capital are really terrified of what they're calling the tsunami of cases coming their way. So we've heard what you've said today about supporting them, but with the gift of hindsight, what specifically have you learned from the response in London, which means that you can improve the response and support for NHS staff across the rest of the country?
Yeah, that's a great question. The first thing I'd say is that building the extra capacity is incredibly important. I'm so proud of the people who've built the Nightingale Hospital in 9 days, and the role of the Gurkhas and the military and the NHS all working together to make that happen. And we are rolling that out to Birmingham and to Manchester and to Glasgow, as I said, but we don't rule out putting temporary hospitals in other parts of the country too.
Yes, and I think we'll be saying more tomorrow on possibilities for additional Nightingale hospitals. So that's something to look out for. But I think the key thing, as I said right at the start, is that the strategy the NHS has taken from very, very early on, when we saw this situation developing internationally, was to get ahead and to ensure that we constantly have capacity which is ahead of the demand that we have and the demand that we can see coming. And that has absolutely been the strategy in London. So the strategy in London of beds for patients who require ventilation, so the most sophisticated of treatment for the people who are the sickest, has been to, firstly, to reduce elective surgery, so that means freeing up some of the beds that would be otherwise used, so where that surgery can be delayed a bit. Secondly, by expanding into other areas of the hospital where we can ventilate patients, so theatre areas, recovery areas, those are areas where ventilator machines are used as part of routine practice around surgery, where the oxygen supplies are all established, where the monitoring is established. And then beyond that, using the independent sector, you will have seen the deal we made with the independent sector to bring that capacity on, and then finally to build a brand new hospital of up to 4,000 beds in the east of London. And that's meant, as I said earlier, as Secretary of State said, that we have been able to stay ahead of this curve. We do need the public, as we've emphasised, throughout this to keep to the instructions that we've given, because the demand needs to be kept under control. And any health system in the world would be overwhelmed if that demand wasn't kept under control by the sort of measures that the government has introduced. But capacity is staying ahead. And you are absolutely right, and it is occurring all the time. Colleagues around the country are talking to colleagues in London so that we can rapidly translate the knowledge that we have from London out to other centres. So I visited the Nightingale Hospital in East London 2 days ago, and I spent some time talking with a team there that is specifically looking at rapid learning from building that hospital so that the key points, the key learning can be rapidly translated